So what's the layperson's definition of commissioning?
So in conversations that I've been having with people around commissioning, one of the perspectives that was put to me was that purchasing of services is rather like somebody going into a supermarket and with a shopping list and going through that shopping list and purchasing all the goods and services that they need there. Commissioning of health services implies that you actually write the shopping list in the first place and you know what needs to go on that shopping list, and then you take the shopping list into the supermarket and then purchase the services there, so it's much wider.
So, but from the other end, the consumer, the patient, do they see then the cake that you've made from those ingredients that you've bought?
I think you can take the metaphor. I think you can take the metaphor wider,
yes,
and really say that it's much more about influencing what should go on the list in the first place,
right, and
getting the evidence for what you need to actually go on the list. And then you're right, taking what you've bought and producing something that actually makes a difference at the end of the day.
But Helen, you were also talking about engaging with everybody that's involved, but surely the consumer is also involved.
They are, but I guess you could take the metaphor wider than kind of going into the shop and buying, because you don't decide what's on the shelves in that place. So you might argue that commissioning is being the person who sets up the store and who works with the different providers of goods to that store, so that there are a range of them there for when the consumer comes through the door. I mean, I think there are huge challenges with using a consumerist metaphor around complex human services, of which health is one, because of the co-productive nature of that. I mean, you co-produce your shopping to the extent that you write a list and you go in and you take the things off the shelf. But I think actually your individuals' interactions with the health systems more significantly co-produce their services, and that metaphor would suggest.
Mm-hmm. Got anything to add, Judith?
Yes, I'd particularly add there that, you know, commissioning is not just about funders going out and obtaining services, because increasingly in all our different health systems, I think we're thinking about the role of individuals and communities in our own health. So the extent to which we modify our behaviour, to whether it's to drink less alcohol, to lose weight, to take more exercise, but also if we've got a particular condition, the extent to which we use our inhalers properly to help manage our asthma, or we eat in a certain way to help manage our diabetes. I think there's that kind of sophistication about the role of individuals and then the support that we're given. That's an increasingly important part here, and I think that absolutely reflects what Helen was saying about the complexity of human services. And I think that that has been enhanced and increased, particularly as the whole kind of role of the internet and social media and other ways there are of engaging us and of us engaging with our services.
So Mark, can you look into the crystal ball and tell us what primary healthcare would look like?
I think this whole conversation actually brings us on to something which is which we've not really got onto, which is so how do you know that it's worked in the end, and what are you trying to do? And I think one of the things that brings this up for me is commissioning a process that actually does have a multifaceted end point, which it may be around cost effectiveness from an economic perspective, it may be around improved health outcomes, it may be around improved population health, or is it a process? Is commissioning a process that just continues and is a process of ensuring that health services and other services such as education and housing, etc., are appropriate to the population that you actually serve? So is commissioning about, yes, I mean, I'd be interested in others' perspectives on this, is commissioning what we're trying to do here a process, as opposed to, well, we know when we've got to the end of it, because at the end of it, it produces X, Y, and Z. And I suspect that that's not a realistic.
I think, though, one of the challenges, I think you're right, it is a process, and it's a process of reform, and provided we continue to have to make difficult choices about resources and how we use them in healthcare, which it looks like we likely are going to. It's going to continue to be a process that goes on. But one of the issues, though, is if you treat it as a means that doesn't have a specified set of ends, then there's a challenge in delivering that. Then also if you've got the process that you're there. So having a sense of what those outcomes are that you're going to deliver, and they will change over time as you deliver them, as the nature of the disease profile and the population and all the other challenges shift over time. So you will revisit those, but in my experience, those areas that have had a clear sense of what they're aiming to and how they play a part in that, and how other partners or other stakeholders, be they clinical staff, local service users, local politicians or what have you, and how they play a part in that, they tend to be more successful in practice.
Last words?
I'd just say, related to that, we must never forget that commissioning costs. The activity is costly, and there's been significant scrutiny of that in England in recent times, largely as a result of our highly constrained public financing situation at the moment, but also back to what I was saying earlier about it is quite a labour-intensive process, commissioning, so it does have to be worth it. And I think we do need some measures of outcomes and some tough questioning sometimes about, is all this engagement effort, all the planning work, is it actually worth it? And of course, we're always going to need to have some of that activity as we try to improve our services, but we also need to have some discipline to keep checking that or the effort that's put into the needs assessment, the planning, the development work is actually worth it in terms of outcomes for patients and populations.
Okay, thank you very much. So thank you again for joining us. And as just to add to the conversation, we've got a few publications that we feel are really important for you to perhaps have a look at sometime in your own time. So we'll put that up on our website soon. Thank you.